Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're going to talk about a major milestone in the treatment of rare immunologic diseases, Waskyra, the first and only FDA-approved stem cell-based gene therapy specifically developed for Wiskott-Aldrich syndrome, also known as WAS. Wiskott-Aldrich syndrome is a rare but serious immune disorder that occurs almost exclusively in male patients. Medically, WAS belongs to a group of diseases known as primary immune deficiencies, and more broadly, primary immune regulatory disorders. At its core, WAS is caused by inherited mutations in the WAS gene, which encodes the Wiskott-Aldrich syndrome protein, or WASP, a protein found only in blood and immune cells. WASP plays an essential role in helping immune cells move, change shape, and communicate with one another. These functions are critical for mounting normal immune responses and coordinating how immune cells fight infection. When WASP is disrupted, many key immune activities are affected. Depending on the specific genetic mutation, WASP function may be completely absent or partially preserved. This helps explain why patients with WASP can experience a wide range of symptoms and varying disease severity. Clinically, classic WASP, the most severe form of the disease, is traditionally described by three hallmark features: infections, eczema, and bleeding due to low platelet counts. These features often do not appear all at once, but typically begin to emerge during the first year of life. However, WAS is more than that. It is also a disorder of immune imbalance. Because the immune system is dysregulated, it may mistakenly attack the body's own tissues or fail to monitor for abnormal cell growth. As a result, patients with WAS have an increased risk of autoimmune and inflammatory complications, as well as a higher risk of developing malignancies over time. Historically, the most established curative intent treatment for WAS has been hematopoietic stem cell transplantation. But not every patient has access to an ideal matched donor, and transplant decisions can be complex. Factors such as donor availability, timing, disease severity, and individual risk profiles all play an important role in determining the best treatment approach. This is where Waskyra changes the landscape. Instead of relying on donor stem cells, Waskyra uses the patient's own stem cells. These cells are collected, genetically modified to correct the defect, and then infused back to the patient after conditioning, aiming to address the root genetic cause of the disease. So, let's go through the 5 most important things every patient and caregiver should know about Waskyra: who it's for, how it works, what the treatment process looks like, important warnings and precautions, and its safety profile. If you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Waskyra and who is for? Waskyra, also known as Etuvetidigene Autotemcel, is an autologous hematopoietic stem cell-based gene therapy approved by the FDA in December 2025. It is indicated for patients 6 months of age and older with Wiskott-Aldrich syndrome who have a confirmed mutation in the WAS gene. This approval applies to patients for whom hematopoietic stem cell transplantation is considered appropriate, but who do not have a suitable HLA-matched related donor. Traditionally, the main curative intent treatment for WAS has been allogeneic hematopoietic stem cell transplantation, often called a bone marrow transplant, using stem cells donated by another person. In this setting, allogeneic means the cells come from a different individual, known as a donor. For this type of transplant to succeed, the donor's immune markers must closely match to the patient's to reduce the risk of rejection and other serious complications. One of the most critical factors in this matching process is the human leukocyte antigen system, or HLA. Unfortunately, many patients do not have an ideal HLA-matched donor available, and proceeding with last will-matched donors can increase the risk of transplant-related complications. This is where Waskyra comes in. Instead of relying on donor cells, Waskyra uses the patient's own blood-forming stem cells. These cells are collected, genetically modified outside the body to correct the underlying defect, and then infused back into the same patient, an approach known as autologous transplant. Second, how does Waskyra work? Waskyra is designed to correct the underlying genetic problem in Was. The process begins by collecting the patient's own blood-forming stem cells, which are then genetically modified in the lab to carry a working copy of the Was gene. To do this, Waskyra uses a specially engineered delivery system called a self-inactivating lentiviral vector. You can think of this as a viral delivery vehicle that inserts the correct Was complementary DNA into the stem cells without being able to replicate or cause infection. After infusion, the corrected stem cells return to the bone marrow where they settle in and begin producing new immune cells and platelets that express functional Was. Over time, this allows the body to continuously generate immune cells that behave more normally. Clinical studies show that Waskyra leads to durable presence of gene-corrected cells and restoration of Was expression. This has been associated with significantly reduced infections and bleeding events, supporting long-term improvement in both immune and blood cell health. Third, let's talk about dosing and infusion. Waskyra is given as a one-time single-dose intravenous infusion, with the dose determined by the patient's body weight at the time of treatment. Although the therapy itself involves a single infusion, reaching that point requires a multi-step process. First, stem cells are collected from the patient. Medications are given to promote blood-forming stem cells to move from the bone marrow into the bloodstream. Blood is then drawn from a catheter and passed through an apheresis machine, which collects the stem cells while returning the remaining blood components back to the patient. The collected stem cells are sent for genetic modification, and a separate backup supply of the patient's stem cells is preserved as a safety measure in case rescue treatment is needed. Before infusion, patients receive preparation medications, including rituximab, followed by reduced intensity conditioning chemotherapy with agents such as busulfan and fludarabine. This conditioning helps make space in the bone marrow so the corrected cells can successfully engraft. On the day of infusion, patients receive pre-medication shortly beforehand to reduce the risk of allergic reactions. The care team carefully verifies patient's identity before Waskyra is infused through a central venous catheter. Vital signs and symptoms are closely monitored before, during, and for several hours after the infusion to detect and manage any reactions early. Because Waskyra is a personalized gene therapy made from the patient's own cells, it is administered only at specialized treatment centers with expertise in cell and gene therapies. Each step of the process is highly coordinated and tightly controlled to ensure safety and efficacy. Fourth, let's look at important warnings and precautions. Allergic or infusion-related reactions, including anaphylaxis, may occur during Waskyra infusion. Patients are monitored closely during and after treatment. Severely low blood cell counts, including red blood cells, white blood cells, and platelets, can occur for several weeks after conditioning and infusion. Supportive treatments, such as transfusions or medications to help blood counts recover, may be required. In some cases, the corrected stem cells may not properly take hold in the bone marrow, a situation known as engraftment failure. If this occurs, patients may need rescue treatment using their previously collected backup stem cells. Serious infections have also been reported related to the underlying disease and the effects of conditioning and immune suppressing medications. Preventive antibiotics and immunoglobulin support are commonly used to help reduce infection risk. Because Waskyra is manufactured using human and animal-derived materials, there is a potential risk of infection transmission despite extensive testing. A serious liver condition involving blocked blood flow in the liver has been reported. Liver function is monitored closely, especially during the first month after Waskyra infusion. Because Waskyra permanently modifies a patient's stem cells, there is a long-term risk of abnormal cell growth. For this reason, patients require lifelong monitoring for malignancy. Waskyra may cause false positive results on certain HIV PCR-based tests, so alternative testing methods should be used if HIV testing is needed. Antiretroviral medications should be avoided around the time of treatment. And if they are required, Waskyra should be delayed and guided by the care team. Lastly, patients treated with Waskyra should not donate blood, organs, tissues, or cells for transplantation in the future. This information is provided on a patient alert card after treatment. And finally, let's review side effects and safety. In clinical studies, 27 patients received Waskyra, with about half followed for at least 5 years. Because Was is rare, study numbers were small, but they provide important safety data. Across the trials, a broad range of side effects and laboratory changes were observed. Importantly, none of the reported adverse events were directly attributed to the gene therapy itself. Instead, these events were consistent with the underlying disease and other parts of the treatment process, such as conditioning chemotherapy and venous catheter use. In total, 45 serious adverse events were reported in 21 patients. This included catheter-related infections, bacterial and viral infections, fever, prolonged low white blood cell counts, vomiting, liver-related complication, and fungal infection. One patient passed away approximately 4.5 months after Waskyra infusion due to neurological deterioration. Overall, Waskyra has a complex safety profile that reflects both the severity of Was and the intensive treatment required. Close monitoring is essential throughout the entire treatment period, and patients and families should promptly report any new or worsening symptoms so the care team can provide timely evaluation and support. And there you have it, 5 key things you know about Waskyra. As the first FDA-approved gene therapy for Wiskott-Aldrich syndrome, it offers patients and families a targeted, disease-directed option with the potential to serve as a definitive treatment when traditional donor-based transplantation is not visible. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.